Quality communication and interactions between nurses and patients has a major influence on patient outcomes. The following scene you're about to see is Erin, who's going to play a sick patient not ready to go home. She originally came in for nausea and vomiting. The physician is trying to discharge her because she's a homeless frequent flyer and there's nothing else to be done. Jordan's going to play the nurse and they're going to act out this scene. And in walks Jordan.
I've been calling you for the last 30 minutes to time my pain medicine.
Mrs. Sanchez, I have your discharge papers.
Discharge papers? I can't go home. Where am I supposed to go?
Oh, we can arrange a taxi for you.
Well, nobody told me I was going home. I'm not ready to go home. I'm in a lot of pain.
Well,
Also, can I have a Pepsi?
The doctor thinks it's in your best interest that you can go home now. You don't need medical care anymore.
Well, where's the doctor? I'd like to talk to the doctor.
Well,
when was he going to come in and tell me this?
I thought he did.
Okay. Do you have my methadone?
I have prescription. He didn't write you a prescription for methadone.
Well, why not?
Did he say he's going to write you a prescription for methadone?
Yes, he did. How am I supposed to get all my medication if you're not going to give
Do
it
you
to
have
me?
a pharmacist? I have prescriptions for you, but I don't have one for methadone.
Well, do you know your HCAP scores are going to go down because I'm not going to say good things on your patient.
Well, they're already down. So,
all right, where's my paperwork?
Sign here.
Who do I complain to about this?
I can give you the number to my charge nurse.
Yeah, I'd like to see the charge nurse, please.
Okay. All right, one more. This page. These are your new meds.
Can you tell me what these are? What is metoprolol? Olo.
Oh, that's for your heart rate and your blood pressure.
There's nothing wrong with my blood pressure.
Oh, well, there is. It's high. But we've been treating that. The metoprolol's been helping that.
So I'm supposed to take that when I feel like it?
No, it's BID.
What does BID mean?
Twice a day, 25 milligrams by mouth.
Why are you asking so many questions? Am I done?
You're done. I need to call for transport. Wheelchair.
I need a taxi. I don't need a wheelchair.
Well, it's policy, sir. I mean, ma'am.
All right, you can leave now. But give me that Pepsi. Can I get that methadone before I leave?
If I give you the methadone, you can't be
All
discharged.
right, well, just leave alone. Just leave. Just call me my Pepsi.
All right.
Oh my gosh.
So here you see a scene where there's not really that great of communication, a huge conflict between the patient and the doctor. They didn't communicate that well. So now they're going to try this again because a nurse's motivation is not to make the patient uncomfortable or to squirm in that situation. It's to encourage the free flow of information. That's the core of every successful conversation. So we're going to see an effective communication and less conflict this time.
Ms. Sanchez, I've got Dr. Smith with us.
You talked to him already?
Yeah.
These are coming as soon as I use the call bell.
Oh, of course.
So great of you to come in so quickly.
We're going to go over your discharge papers together.
Okay.
Are you ready to go home?
I mean, I guess if that's what you guys feel like is best for me.
Well, we're going to set you up with the right resources that you need and send you home with your prescriptions.
Okay, great.
Do you have a pharmacy that you can use?
I think I can find one.
Do you have transportation to get there?
No, but I was told that you guys could set me up with a taxi.
Yes.
Okay, great.
And we can give you a one-stop at the pharmacy before you go home.
Okay, that would be wonderful.
Okay, so these are your discharge papers, and we need you to sign those, and then you have medications. Metoprolol for your blood pressure.
Metoprolol for my blood pressure, okay, and I take this how many times a day?
Twice a day.
Twice a day.
With breakfast and dinner.
Once for breakfast, once for
dinner. And then we're starting you on Protonics.
And Protonics.
For the nausea.
For?
It's for your stomach. It should help with your nausea and vomiting.
Okay, and how many times a day do I take that?
Once in the morning.
So just once a day for Protonics. And Metoprolol is once a day too?
Twice a day.
Twice a day. This is all written out for me on a chart.
Yeah.
Oh, you guys are so great. Thank you. All right, so I'll keep this one.
Do you have any questions for Dr. Smith,
Um,
who's standing here?
yeah. Dr. Smith, are you sure it's okay for me to go home?
Yes, Erin, I am.
Thank you for coming.
If you have any questions or concerns, Dr. Smith has his.
Oh, his number's right here on here, so I can call if I have
And you need to make
pain, signs or symptoms of a stroke, hard time breathing, okay, difficulty talking. I'll call you.
And he's already set up an appointment with you for 1 week to see him in his office. He wants to see how you're doing.
Okay, great. That's great. And now, how about pain medicine? Can I have some pain medicine before I leave?
No.
Okay.
You have plenty of that at home?
I have a prescription I can get tomorrow.
Yes, you can get that filled at your pharmacy.
Okay, thank you for being patient with me and answering my questions.
You're very welcome.
I know I'm not the easiest patient all the time, but
Oh, it was a pleasure.
you guys do a great job.
I'm going to call for the wheelchair to wheel you out,
Okay.
and we'll get you your taxi voucher.
Thanks, nurse.
You're welcome.
Appreciate you.
So there you see how the nurse brought in the doctor to reduce the conflict that had happened in the first scene and actually gave better instructions regarding her discharge paperwork. As you can see, communication is a big part of nursing care, and we strive to do that every day.